Hi, this is Doug.
And I'm Cindy.
Welcome to Help Me Help Mama 5cast. And today we are doing a review of an article by Savannah Rudisill and Zoe Brown. Local nursing home makes changes to help residents with memory loss eat more. This is an article about, and we've seen this in culture change. A lot of nursing homes are doing this now. But this particular nursing home, Senior Start, Wexford Place in Kansas City, making some changes to help the seniors in their facility.
Okay, so this would be like in our local area. There's a skilled facility, a nursing home that has two different levels of care. One is the general population where most residents are. They have no memory issues, or very few anyway. And then they have a memory unit, which is for people that have cognitive decline. And at this point, where that would tie in is like they're not eating as well. Sometimes, for any number of reasons, it's because of the illness, the Alzheimer's or some other form of dementia, that they forget to eat, or maybe medications, or they feel like they're not hungry. So one of the things they did was to use colorful plates.
Yeah, because it's easy, and we've heard Alzheimer's trainers before talking that, people, especially with more advanced Alzheimer's, really can't tell where, the food ends and the plate begins. It just looks like the same pattern, pattern. So with colorful plates, that's one thing that helps.
Yeah.
Finger foods eliminates one thing, eliminates a fork or a knife, or both, worse yet, both, having to cut up your food. They can just pick it up and eat it. And, the caregivers at the nursing facility sit there with them and help them eat and encourage them to eat and talk with them while they're eating. That's a big thing if you're caring for a loved one at home, just the smell of the food. A lot of times the smell stimulates the appetite, and sitting there with them.
Sitting there with them, having lunch with them, or breakfast or dinner, and talk. And at a facility, there may not be enough staff for each person to help them eat. But you want to make sure that they eat and don't lose a lot of weight. So the finger foods helps. It's easier for them because they can get to the point where they would push the food off of the plate, or they can't utilize the utensils to get the food actually to the mouth. But with the finger food, easier to pick up and get to their mouth and eat it.
And this article also points out that this lady had been used to having hot tea with her meals
before she entered
the nursing home. For like the last 10 years or so, she'd just been in the habit of having hot tea with her breakfast every day. And finally the nursing home, sounds like, just basically discovered that, she likes hot tea with her meals. This is where the advocate comes in, and we talk about this sometimes. If your loved one goes to Journey Stop 4, like to a nursing home, your job's not over. Maybe you're not the family caregiver anymore, but you take off the caregiver hat and put on the advocate hat. You are their advocate, and your role is to make sure that, among other things, make sure they get good care, but among other things, little details like this that the nursing home would have no way of knowing.
Absolutely.
You do. It's your mom. And so hey, mom likes tea with her breakfast. And that's just a little thing. It's a simple thing, but it's a big quality of life thing that if mom gets tea with her breakfast, it's going to make a difference.
Comfort. It's comforting to her emotionally.
Thank you so much for watching. We appreciate your comments. We appreciate your input. Please leave any comments. If you haven't subscribed to this YouTube channel, please hit the subscribe button. Click the notification bell at the top so you'll be notified of future videos. And thank you for watching.
And thank you for being a caregiver for your loved one. You're making a huge difference in their life.